I always ask people if they have support, because I think that's key. If they do have family and friends that they can call on. I think that there's a lot of things that Mott offers with social work and things of that sort to call on.
Friends and family. Actually, we'll start with family. Family was immediate. The family, from the moment that we had the diagnosis to that next morning in surgery, the family was together and supportive, and to this day is still supportive and with us. They've been there, again, right from the start. Our immediate friends they were certainly supportive. They found the news and they rallied around you. And again, it's something that you need to take in. You have to embrace that support. You have to seek the support, because you can't do it by yourself. You need that help.
Oh, it was difficult. My older son was 2 when Tommy's health journey began, so it was one of those things where I always had to make arrangements for my toddler when I was in the hospital for long periods of time with Tommy. And that was challenging and hard to be away from him, but I was fortunate that I had family that would bring him here to the hospital to visit and kind of stay connected that way. And then when we thought Tommy was sort of over a lot of his surgeries, I ended up having my daughter. So that was difficult as well, because I had a baby, and at the same time I had a child in the hospital. So that was a struggle. But again, called on family to help sort of take care of her at home, bring her here when it could be done, and then just the logistics were sometimes of managing the children were almost sometimes more challenging than being in the hospital and waiting for Tommy to get over whatever he was dealing with. That was definitely a big hardship, and you just kind of have to take it one step at a time and look at today and try to manage what I have in front of me today. And it's oftentimes it all works out. Somebody comes to help, and it ends up working out.
I always say that faith, family, and friends are really what gets you through some of the hardest times in your life. We have a great church that we belong to. Our friends really stepped up to the plate, and even though it's hard for some people to understand what to say or what to do in a situation like that, they really do want to help. And part of what you have to learn as a parent is to accept the help. We had a lot of people that could step up and help us at any given time, and we were lucky to have, our employers were very supportive and would let us take off time if we needed to, and we did. I mean, Michael had 84 treatments of chemotherapy over 15 months. I don't know how many scans. I never counted that. 50 days of radiation. And endless other procedures and tests and things, echocardiograms, lots of different things. And so we did. We had kind of an army of people that we would train, or you show them how to come down here. We had the kids' friends were just as involved. They'd come down and sit with Michael during chemotherapy treatments for a whole day. I mean, sometimes you're here for 10 hours a day or more, and it's just, it was so nice of these kids to step up to the plate in a way that was really kind of scary in a way, but once they learned what it was kind of all about, it wasn't so scary,
Do you think that there's something that people do for your parents that help them?
They give us like gas cards, because we gotta travel down and back. Gas is getting expensive these days. Also, cooking meals for them. I think that really helps, because my mom will come home and she's so tired, and having that meal already there helps.
It's emotional because people come out of nowhere to help you. and it's very humbling, especially when you're used to being so independent, and it's really, really, really hard to accept that help, but you have to. You have to do it. I had somebody knock on my door one time and bring me dinner that I didn't even know, and I was so overwhelmed. It's humbling. And you just know what a difference it makes, you know? It's hard to accept help from people that you don't know.
There's a really remarkable team of professionals here, and you may not realize it at the time, but looking back at those moments, I realized that everybody was there for a purpose, and they had something to bring to the table to help us educate and understand the condition that our son had and how we were going to help get him home and get him cured and get him back to being a kid. We had social workers stop by. I mean, sometimes it feels like just, you know, a lot of people and a lot of information, but if we were getting overwhelmed by that, we could always just say, you know what, we need some more time. And they were very respectful of that, and they'd come back whenever it was good for us. And but it was good that we did talk to all these different people, all the different resources that U of M offer, because without that, we wouldn't have been able to get the big picture of how we could better help and serve our child, and then how we could be an advocate for our child, and then find out all the resources that were available to him to help him get better.
When I was 3, when I was diagnosed with brain cancer, my neurosurgeon, Dr. Marasco, my hero, she told my parents that we were going to be lifelong friends. And every year, I've been seeing her, some years more often than others. And to this day, it's true, we are going to be lifelong friends. And she said that she wants to dance at my wedding, so I could be leaving the hospital, but my friends at the hospital will still remain.
There are people here called child life specialists. They're really amazing. Basically, they're here to help the child adjust to, you know, being in the hospital. They find out ways to make them happier, to keep them busy, to, you know, have fun, to laugh, and they're really just a wonderful resource here. They also came to my son's school, sat down and spoke with all the teachers, the administrators, and said, this is what's going on. And, you know, Michael has cancer. He's having a port put in his chest, and this is what it looks like. They actually had visual aids that they could show him. And it was so helpful because these teachers really, some of them had no experience with cancer at all.
Within the hospital for Max that helped his existence here was, we call it the toy room. There's, I think, a child life support group which was available, and they were outstanding. I mean, the activities on a daily basis that were provided, you know, ended or helped deal with the long days that are spent here. Days, like I said, can be very, very long, but his trips to the toy room with the staff people really assisted, and through the holidays, every holiday was approached with Halloween or Thanksgiving or Christmas, and preparing for that, and different events would be held. So that's what I remember. I remember the kindness, a lot of generosity with support groups who we didn't even know.
Child life was amazing, and they would, when he would be isolated to his room, they would come to the room and, you know, set up crafts and whatnot. We would take advantage of a lot of the activities that we could go to around the hospital, the music day and things of that sort. He loved doing that. We would also take part in the Skyline Cafe and the music and just to, you know, you're not getting away, but you're kind of getting away when you get out of your room. I would highly advise getting out of your room when you can get out of your room. And now that everybody has their own private room, it's a little different. So that would be one thing. You know, visitors, if you can have visitors, that helps pass the time.
It's not fun to be in the hospital, but there's a lot of board games that kind of keep you distracted from it, and they do the best they can to make you feel comfortable.
Well, the staff is always nice to know to you know, make you feel more comfortable during that time, and you know, there's child life specialists that, you know, if you want an iPad or an Xbox, they can give it to you, and so that made it more bearable.
The toy room really helped me because it gave me something to do and it was fun, and that's what kids like to do, right? Play with toys. And what my family also did, what really helped, was pictures. Lots of pictures and lots of stuff from home in my room to make the hospital feel more like home.
To help us cope with Max's condition, what the hospital did for us that I took from the hospital was first the support groups that were available to us within the hospital. At any moment, if we ever had questions or any fears or any concerns, there was support groups that were provided by the hospital that were available to us, and that helped.
Our experience with palliative care has been wonderful. We had a few issues with the doctors a little bit. Like Laura, they wanted her to use the sip and puff, which is a form of a ventilator, but you hold it in your mouth and it breathes for you, and then you take it out, and then when you need air, you put it back in. She was weak, had a hard time getting it into her mouth and everything, and so they really didn't want to trach her at that time, but we got palliative care on board with us, and they helped us with the decision of making it with the doctors and everything. They were very supportive of that. They also came and checked on us every day to see if there was anything we needed in the hospital, how they could make Laura's stay more comfortable, very supportive of our family. I can't say enough about palliative care. It's not an end-of-life thing. It's just to make sure that your child's taken care of while they're in the hospital.
There's a lot of resources outside of the hospital that are available to kids, like camps, summer camps and programs where other kids that have the same illness or disease can be together, and there's this amazing unspoken bond that these kids have upon meeting that is something you can't give them as a parent. You know, other kids that are healthy can't give them. It's like this is something that they all just intuitively understand because they've been through it. And I've seen my teenage sons bond with little kids, which you wouldn't think they would do because they're teenagers, but they do because they just have this understanding of what they're going through or what they've been through, and it's comforting to them to know that there's other kids that have gone through it because they feel so alone in this.
I go to event camp in June through U of M.
And what's good about going to that?
Everyone's the same. We all understand each other. No one's different there, and we're all just treated our age and equal.
For me, a support group has been helpful, and personally I've helped found a support group for kids with heart defects here in Southeast Michigan, so that's a huge thing, you know, just to be able to connect. And I also volunteer at the hospital here and visit families, and they just want to know that they're not alone and that there are other parents and families going through similar things, and there's a lot of comfort found in that. So by, kind of going on to the social networking support or through support groups like we have and where we have get-togethers so that when the kids are home and doing well, they can come together and they know that they're not alone.
I found as far as community resources, they just kind of fall in your lap. It's been my experience, and you have to pay attention to what's coming at you and make decisions. Not everything is useful for me. There are lots of support groups, and I find that I spend, because of my background, I spend more time giving information than getting information, and I don't have a lot of time for that. So I kind of pick and choose the resources that I find useful for us, for what I'm willing to spend time on. but they all just kind of come at you. People will let you know. You have to listen to what people are telling you and find out about what that resource is and just make an educated decision as to whether or not it's useful for your family. But the resources they just come from everywhere.